Today we will discuss something about fungal infection of skin. So it is a very common infection where you will get red patches on various areas of body. The most common are groin, buttock, armpit, but can affect all areas of the body. So a ring-like round reddish lesion appear and it gradually expand along with itching. Let's be clear. Most of the people use for anything on skin red and itchy to be a fungal infection, but it is not true. There are many other diseases which can look like fungal infection, like psoriasis, eczema. So it is very important to properly diagnose fungal infection because the treatment are pulls apart. So we are using steroid in eczema, we are using antifungal in fungal infection. So if you diagnose wrong, so we are not going to get results. Another common mistake people do, they just go to the different medicine store and they ask for a cream. I have an infection, fungal infection, please give me a cream. And what they do, they usually give a mixed cream which contain antifungal, antibiotic along with steroid. So this causes the problem. Whenever you are applying steroid in a fungal infection, you may get remission for 1-2 days, but the infection will be pushed deep into the skin and it will again reappear with increased severity. So there the problem. If you go on applying the that mixed cream or any steroid cream, you may get some relief, but if you are again and again, the infection will go deep. So let's do a proper diagnosis for this and start a proper antifungal. Next is how to prevent the infection and how to prevent recurrence. So first is a proper diagnosis, next starting a proper treatment, and the most important thing is keeping yourself clean. So whenever you are having a wet skin, whenever you are your dress are getting wet with the sweating or any water work, you must change your dress immediately. You should not share your dress, clothing, towel or rumal with any other person. You should not share your bed with any other person. If you are having an infection, then you should not use a swimming pool. You should not share your clothing. So this you have to follow. Okay. So what about black fungus? The black fungus is the infection of soft tissue, usually sinuses, lungs, and it is a deep fungal infection which is now occurring in patients who are recovering from corona infection. Right? This happen again due to a compromised immunity either due to diabetes or a long dose of steroid which the patients are given and they can have this deep fungal infection. So this is something different which people are calling it a black fungus. This is a bit of serious infection and it is not related to our skin infection. Thank you.